Your doctor writes a prescription. You fill it. $200 later, you're taking a pill with side effects longer than the benefits. But what if the most powerful heart medicines weren't in your pharmacy, but in your kitchen? For thousands of years, ancient civilizations treated heart problems without statins, beta blockers, or blood thinners. They used spices, concentrated plant compounds so potent that wars were fought over them, economies built around them. Modern science is finally catching up, revealing what our ancestors somehow knew. Certain spices don't just match prescription heart medications, some actually outperform them. The difference? These natural compounds work with your body's own mechanisms instead of forcing single pathways. They target multiple systems at once without the cascade of side effects. In this video, we're exposing the 6 ancient spices that clinical research shows can rival or even surpass common heart medications, backed by studies your doctor probably hasn't seen. Turmeric, the inflammation extinguisher. In your body right now, there's likely a slow burn of inflammation damaging your arterial walls. It's silent, invisible, and it's the root cause of heart disease that medications often miss entirely. Enter turmeric, the golden spice that's been used for over 4,000 years in Ayurvedic medicine. Its active compound, curcumin, is now proving to be one of the most powerful anti-inflammatory agents ever discovered. A groundbreaking study in the Journal of Biological Chemistry found that curcumin is hundreds of times more potent than aspirin at inhibiting cyclooxygenase 2, the enzyme that drives arterial inflammation. This matters because while aspirin works on just one inflammatory pathway, curcumin works on over a dozen without damaging your stomach lining. Even more impressive? A clinical trial at Chiang Mai University found that curcumin reduced the risk of heart attack in bypass patients by an astounding 65% compared to placebo. That's better protection than what many prescribed medications achieve after heart surgery. For therapeutic effects, aim for 500 to 1,000 milligrams of curcumin daily. Since curcumin is poorly absorbed, always combine it with black pepper and healthy fat. The most effective combination is 1/4 teaspoon turmeric, about 500 milligrams, with a pinch of black pepper and a teaspoon of olive oil or coconut oil. Golden Heart Tonic. Warm 1 cup unsweetened almond milk. Add 1/4 teaspoon turmeric, a pinch of black pepper, 1/2 teaspoon cinnamon, and 1 teaspoon of honey. Drink before bed for arterial protection while you sleep. Turmeric, ginger dressing. Blend 2 tablespoons olive oil, 1 tablespoon lemon juice, 1/2 teaspoon turmeric, 1/4 teaspoon black pepper, and 1/2 teaspoon grated ginger. Drizzle over salads or vegetables for a heart-protective finish. Cinnamon, the blood sugar regulator. Most people think controlling cholesterol is the key to heart health, but there's another number that might matter more: your blood sugar. Elevated glucose damages blood vessels, increases inflammation, and is directly linked to higher rates of heart attack and stroke. Yet conventional doctors often miss this connection, focusing on cholesterol while ignoring the sugar spike after every meal. This is where cinnamon, one of the world's oldest known spices, shows its remarkable power. In a landmark study published in Diabetes Care, researchers found that just 1 gram of cinnamon daily reduced fasting blood glucose by 29%, LDL cholesterol by 27%, and triglycerides by 30% in patients with type 2 diabetes. These results rival what medications like metformin and statins achieve, from a spice that costs pennies per dose. The therapeutic dose is 1/2 to 1 teaspoon daily, about 1-2 grams, preferably divided through the day. Ceylon cinnamon is the safest for daily use as it contains less coumarin than the common cassia variety. Morning cinnamon toast. Top whole grain toast with 1 tablespoon almond butter, 1/2 teaspoon cinnamon, and a drizzle of raw honey for a breakfast that stabilizes blood sugar instead of spiking it. Cinnamon apple bedtime snack. Slice 1 apple and sprinkle with 1/2 teaspoon cinnamon. The combination slows sugar absorption stabilizes overnight glucose, and supplies pectin that helps lower cholesterol while you sleep. For a quick supplement, add 1/4 teaspoon to your coffee grounds before brewing. The heat doesn't destroy cinnamon's active compounds, and it reduces coffee's acidity. Garlic, the plaque reverser. For over 5,000 years, garlic has been used as medicine. Ancient texts from Egypt, Greece, Rome, China, and India all praise its healing powers. Now, modern science confirms what these civilizations somehow knew. Garlic doesn't just prevent heart disease, it can actually reverse it. The most stunning evidence comes from a study published in the Journal of Nutrition, where aged garlic extract actually reversed existing plaque in coronary arteries. Participants showed a 7.5% reduction in plaque volume after just 1 year, something that many cardiologists believe impossible without intensive pharmaceutical intervention. The therapeutic dose is 2-3 fresh cloves daily, 4-6 grams, or 600 to 1,200 milligrams of aged garlic extract. For fresh garlic, always crush or chop it and let it rest for 10-15 minutes before cooking. This activates the enzyme that creates its medicinal compounds. Heart healing, garlic spread. Roast a whole head of garlic until soft, then squeeze the cloves into 2 tablespoons olive oil with a pinch of salt. Spread on whole grain bread or use as a vegetable dip for a full therapeutic dose. Mediterranean garlic soup. Sauté 10 cloves of minced garlic in olive oil until golden. Add 4 cups vegetable broth, a can of drained white beans, spinach leaves, and lemon juice. This delivers a full medicinal dose in a delicious meal. For those who can't tolerate the taste or smell, aged garlic extract capsules provide the same benefits without the odor. Take 600 milligrams twice daily with meals for plaque-reversing effects. Ginger, the circulation enhancer. While pharmaceutical companies develop expensive drugs to improve circulation, this ancient rhizome has been boosting blood flow for centuries in traditional Chinese and Ayurvedic medicine. Modern research shows ginger contains over 400 active compounds with profound effects on your cardiovascular system. Chief among them are gingerols and shogols, which activate a cascade of pathways that pharmaceutical companies have spent billions trying to target individually. A 2017 study in Nutrition showed that ginger acts as a calcium channel blocker, the same mechanism as expensive hypertension drugs like amlodipine, but without the edema and constipation that plague many patients. The therapeutic dose is 1-2 inches of fresh ginger daily, about 4 grams, or 1,000 milligrams of dried ginger in capsules. Fresh ginger is most potent, especially when used raw or lightly cooked. Circulation boosting, morning shot. Juice 1 inch of ginger with half a lemon and a small apple. Take this 2-ounce shot every morning to energize your circulation for the day. Ginger miso soup. Simmer 2 inches of sliced ginger in 4 cups of broth for 10 minutes, then add vegetables, miso paste, and tofu. This warming soup delivers a full therapeutic dose of circulation-enhancing compounds. For cooking, add 1 tablespoon of freshly grated ginger to stir-fries at the last minute to preserve its active compounds. For tea, steep 1-inch sliced ginger in hot water for 10 minutes. Drink 2-3 cups daily for maximum benefits. Cayenne, the blood pressure normalizer. When you think of heart-healthy foods, fiery cayenne pepper probably isn't the first thing that comes to mind. Yet this potent spice, used by ancient Mayans and Aztecs, contains a compound so powerful it's now being studied as a model for blood pressure medications. The active component, capsaicin, works by activating the transient receptor potential vanilloid 1, TRPV1 channel, a mechanism that directly relaxes blood vessel walls. A 2010 study in Cell Metabolism found that capsaicin activates the same pathway that current blood pressure medications target, but through a different mechanism that causes fewer side effects. The therapeutic dose is 1/4 to 1/2 teaspoon of cayenne powder daily, about 1-2 grams, or 100 to 200 milligrams of capsaicin from supplements. Blood pressure. Tonic. Mix 1/8 teaspoon cayenne pepper, 1 tablespoon apple cider vinegar, and 1 tablespoon lemon juice in 8 ounces of warm water. Drink every morning to support healthy blood pressure all day. Metabolism boosting. Eggs. Scramble 2 eggs with 1/4 teaspoon cayenne, diced bell peppers, and a handful of spinach. This delivers a therapeutic dose of capsaicin with proteins that support arterial repair. For those sensitive to heat, start with just a pinch of cayenne in soups or stews, gradually increasing to the therapeutic amount. Capsaicin capsules are an alternative for those who can't tolerate the spice but want the cardiovascular benefits. Saffron, the emotional heart healer. The connection between emotional health and heart disease is powerful but often overlooked. Depression increases heart attack risk by 30 to 40%. Anxiety disorders raise it by 20 to 30%. And chronic stress causes inflammation that directly damages cardiac tissue. Enter saffron, the world's most expensive spice, revered in Persian medicine for thousands of years as a mood elevator and heart tonic. What modern science has discovered is astonishing. Saffron contains compounds like crocin and safranol that not only protect the physical heart, but heal the emotional one as well, a dual action that no pharmaceutical can claim. Clinical trials show saffron extracts perform as well as prescription SSRIs like fluoxetine, Prozac, and imipramine for depression, but without the sexual dysfunction, weight gain, or emotional flatness. The therapeutic dose is small, just 15 to 30 milligrams daily, about 15 and 30 threads, is effective for both mood and cardiovascular benefits. Calming saffron. Tea. Steep 5. 7 saffron threads in hot water for 10 minutes. Add a small amount of honey and drink before bed to reduce stress hormones and protect your heart overnight. Persian jeweled rice. Add 15 saffron threads to 2 cups of rice with small amounts of orange zest, pistachios, and barberries. This traditional dish delivers a full therapeutic dose of saffron's mood-stabilizing and heart-protecting compounds. For a simple daily dose, crush 10 threads and steep in 2 tablespoons of warm milk for 10 minutes. Add this golden liquid to your morning coffee or tea for an invisible but powerful heart tonic. Despite its cost, saffron is extraordinarily potent in tiny amounts, making it more economical than many supplements or medications when used correctly.